You've heard us mention that Kelly Services is self-insured, which describes how Kelly Services pays medical and dental claims. But what does this really mean? And more importantly, why should you care? Let's take a few minutes to discuss why this term has such a big impact on us as a company. Being self-insured has advantages. It gives us far more control of benefit plan design and cost containment than private insurance. A self-insured plan can offer the same insurance for lower administrative costs and no profit. That's what makes it worth the risk. When a company is self-insured, they are taking on the financial risk of providing healthcare benefits. So, where is the risk to Kelly Services? Claims are paid from your per-pay deductions and Kelly's company contribution. If the total claims exceed the amount contributed, Kelly Services is responsible for the additional cost. Many people think an insurance company like Blue Cross Blue Shield of Michigan pays for the claims, and that is not correct. Kelly Services is the one responsible for the additional cost. That's why we've got to work together on being smart when using the plan so we don't exceed our expected claims costs. If that does happen, there is impact on deductible amounts, coinsurance percentages, Kelly's contributions, and yes, your paycheck contributions. We don't want you to think we are telling you not to use the plan when you need it, but rather how all of these factors tie into the phrase you've heard more and more lately: we want everyone to be smart consumers of healthcare. Since the money to pay claims comes from you and Kelly Services, we want to be able to control our claim costs and help keep our medical plans affordable for everyone. We will share tips throughout the year on how to help control healthcare costs, but here are some quick ones to get you started. Make smart healthcare decisions. You have many choices when it comes to healthcare services. For example, use the telemedicine services and urgent care instead of going to the emergency room for non-emergency related visits. Another helpful tip is to ask your doctor for generic medications instead of brand name. Get your preventive care exams and screenings. Early detection can save you time and money in the long run. Even with the preventive services covered at 100%, which means no deductible, no copay, no coinsurance. Per 2018 utilization on our plans, only 25% of the people covered under a Kelly Services medical plan get their annual physical each year. It's time to take better care of ourselves because prevention is key and free. Use the free programs and resources under our plans to help keep your health in check. Our medical plans with Blue Cross Blue Shield of Michigan and Kaiser have great programs to help you manage chronic conditions. You can find these programs on the member portal or BCBSM app. Also, did you know you could shop around when you are deciding where to go for care? For example, when your doctor gives you an order for an MRI, most people go to the local hospital and don't pay attention to the cost or quality of that facility. Did you know that a standalone facility could cost less and provide higher quality of care? Use Blue Cross Blue Shield of Michigan's cost and quality comparison tools on their website at www.bcbsm.com to price out potential costs and provider quality before you receive services. This could help you save on your out-of-pocket expenses and also help Kelly Services save money for the service. Being a smart consumer can help keep premiums down the following year. Together, we can make a difference and control the rising costs of healthcare.